We have our first case of measles in El Paso County since 1992, I think it is, and that is a woman that was admitted to Penrose Hospital, an individual admitted to Penrose Hospital on the 3rd of January. What we're in the process of doing is working with the hospital and with the state health department in tracking any and all people who were exposed to this person, and basically just monitoring them. The first question we'll ask is whether or not they've had adequate immunization, and if they have, measles vaccine is so highly effective that it nearly altogether puts them out of risk. Not completely. It's not 100% effective, but 2 doses are very close to that. So that, I mean, that is the basic scenario. I guess I should say that this is also thought to be related to what is turning into a multi-state outbreak. So far, it involves at least Colorado, Utah, and California that traces back to a period between December 15th and 20th in Disneyland. You may know that measles has been eliminated from the entirety of the Western Hemisphere. So anytime we have a case like this, one case constitutes an outbreak and a lot of activity, because it really means that it's been introduced from somewhere else. So the likelihood is that someone came into Disneyland from outside the country, from some place that measles is still endemic, and managed to be infectious and begin spreading it around to a number of folks. So with that, I'll just throw it open to all of you for questions about.
Just talk to us about the risks for people here in our area that were in the hospital at the same time as this patient, and that sort of thing.
Well, the risk for people who were in areas where there was a shared air system within hospital are really limited to people who may have never been vaccinated or were born after 1957. Most of those of us who were born before 1957 actually had live measles infection. And that was so common back then that nearly everyone is immune in that category. So if you were born before 1957, if you've had 1 or 2 live measles vaccine from 1968 onward, you're really not likely to acquire it. We know enough about the hospital air circulation system that we can say the only people who effectively were exposed would have been people who were in the emergency room between 9 and 6 o'clock in the evening, and I'm sorry, 7 o'clock in the evening, and then on the 4th floor of the hospital between, help me out, 4 and 11.
Do you have any idea about how many people that is that could have been exposed?
Yeah, it's roughly, the numbers I recall are roughly 70 healthcare workers and about 200 patients.
Are you concerned at all, because there has been this movement in the past several years of parents who choose not to have their children get vaccines when they're young? I mean, that there's been a lot of misinformation about that.
Sure, that's always a concern of ours. What we will be doing very specifically in this circumstance is contacting all of these people that we were just talking about who may have been exposed, and determining what their vaccination history was, and that will include both adults and any children that might have been in those areas at that time. There were also some household contacts, and we've got information on all of those folks and exactly when their exposure was and what their immunization status was. So we'll track all that down, and the likelihood is that the immunization rate is going to be pretty high under these circumstances, but that's part of what we do when something like this happens, is be certain of that.
Any concern for the community at large, since again it is present in other states?
Certainly there's concern for the community at large. That's really what our investigation of all of these potential contacts is about, is to try to identify who might be at risk. The people that, say, for example, were not immunized at some point, if they're a healthcare worker, they're taken out of the clinical setting so that they don't have the potential to expose anyone else. If they're a private citizen, then we would work toward trying to isolate them and keep, advising them to stay away from the general public, and then monitor whether or not they have any onset of symptoms. Because this individual was just in hospital exposing folks for part of one day on January 3rd, what we do is we'll track that out to January 24th, which is sort of the end of the incubation period. And what that means is the time that an individual is exposed to the virus, and say breathes it in, for example, to the maximum time it would take that virus to then generate illness. By the time you're out to January 24th, we're out of the woods.
I was going to ask, you guys have 70 healthcare workers and about 200 patients at the hospital. How many of those folks have you already begun contacting, and how many folks do you still need to contact for that?
That's a good question. Marini might know the answer to some of that. I would guess on the patient side of it, probably in the neighborhood of 20 or 30, would you think? I don't know how big the family group is. That's mostly who we've contacted so far.
So those at the hospital currently, they've started with staff members, and it's the hospital's responsibility to contact those staff members.
Right.
Through their occupational health. We here in public health have reached out to approximately 15 family members who may have been exposed.
Yeah, right. So I was pretty close. On the patient side of it, around 15 to 20 people have been contacted so far. And as Marini was just pointing out, for the sake of the microphones here, on the hospital side, the hospital infection control folks do that. And they've already begun the process, and I don't know how many people they've already contacted. Probably quite a few out of those 70, I would think. They're able to contact them rather quickly.
Can you talk a little bit about what kids are protected now? Is it like a common vaccine that you still give out to kids?
Yeah,
So-
and they should receive their first dose at about 12 months of age routinely, and then a second dose anywhere from a month after that up to about age 5 are what the recommendations are. If they don't get the second dose by 5, we'll still try to get them later. So the recommendation is now for 2 doses. It's part of the routine immunization schedule.
Is measles kind of like chickenpox, where it gets, if you're an adult and you get it later on in life, it's a lot more serious?
Not quite as much as it is the case. It's actually more threatening to infants and children than it is to adults in general, although it can be quite serious for adults.
What's the big picture here? I mean, you hear measles outbreak, this is something we probably didn't think we'd really ever see. And now it's not common. So what's kind of the big picture of what we're dealing with?
Well, you're right. It's not common, and as I said earlier, it has been eliminated in essence from the Western Hemisphere. It will probably be a target for eradication after the polio campaign because the vaccine's good enough to accomplish that. In the meantime, though, the big picture is that we experience every year all across the United States a number of sometimes small, sometimes somewhat larger measles outbreaks that are generally associated to introduction, and almost without exception, the majority of the people that get measles in those outbreaks are unimmunized. So this is a circumstance wherein what you were referring to earlier is really, really important, because people feel that they are safe sometimes by virtue of the fact that many other people around them are immunized. So they maybe don't get their children immunized. And the reality is that if the disease is brought into the community, it will preferentially turn up in people that are unimmunized, especially with this vaccine, because it's so good in the first place. You don't have a lot of people that were immunized that get disease later.
If you get the vaccine right now, like when does it kick in and help you if you come in contact with somebody that has it?
If you're getting the vaccine for the first time, the first dose, it's about 2 weeks. Although there's kind of a curve that runs with that. And in some circumstances, when we have these outbreaks, if you're able to identify it very, very quickly and make the diagnosis very quickly, there is some effectiveness of the vaccine used within 72 hours of exposure. And that's what that amounts to, is really having given the vaccine and have it outrun the incubation period of the virus. The principle is basically the same. You've got roughly 10 days to 2 weeks for the immune system to kick in and create that response, and sometimes you can actually outrun the virus incubating in the body by doing that.
Can you talk a little bit about the symptoms too? Like how do you know if you get?
Yeah, I mean, classic measles will present. It's kind of I like to say it's kind of a common viral prodrome, except for there are a couple of other twists with measles that are helpful to us, frankly. And I should also say that the physicians at Penrose were really on the spot about this. The admitting physician recognized that this might be measles, brought in an infectious disease consultant by the next morning, and that really helped. Partly because some of the early symptoms are like other viruses, runny nose, for example, and cough. But the things that are a little bit distinguishing is that people with measles will often have conjunctivitis or red eye, pink eye. Sometimes these funny little things called Koplik spots in the mouth, which are actually rather hard to catch. But those are the things that show up first. And then 2 to 4 days later is when the rash shows up. And the rash is pretty distinctive. It starts somewhere up here around the hairline, and it will gradually move down in sort of either kind of little bumps or splotches. And as it moves down, it it begins to coalesce into rather big blotches. And it'll go all the way, sometimes clear down to the feet. Even the palms and soles can be involved. So that's typically how it presents. And the rash and its progression is pretty distinctive. And if it's followed by that business of runny nose, cough, conjunctivitis, fever, it very often presents with a fever, just a little bit for the cough and conjunctivitis.
I was reading it's pretty contagious. Can you talk about that?
It is very contagious, which is why I referred to a need to understand the air circulation in the hospital between these different rooms. To use an example, in this room, if we were locked up in here for an hour or so, and I had measles, I could easily infect the whole lot of you if you were not immune. It's a respiratory virus, And it moves in what we call small droplets, which means if I cough, it goes all over the room, basically, rather quickly. So the air circulation system in the hospital and just which rooms are served by which units was quite important to understand. And that helped us in this circumstance, actually, because it is fairly limited. It turns out that the fourth floor, where this patient eventually was housed, has its own circulation system. So good, you don't have to worry about 2 and 3. The ED is and the CAT scan suite are on the first floor. They share an air circulation system, but that's all we had to worry about, as opposed to the entire hospital. Could have been much worse.
Do you expect to see another case? Would you be surprised to see another case here because of this?
To be honest, no. I really don't. Could get surprised, and the answer to that really then again comes down to whether or not people are adequately immunized. My assumption is that there's going to be a pretty high immunization rate, and it's not going to be a big issue. We know quickly what the circumstance, we already know the immunization circumstances for the roughly 70 hospital workers. So that's easy, and we don't have much to worry about there. It's the patients, and they don't have good immunization records with regard to measles vaccines, so that's something we are going to be checking by literally ringing everybody up and saying, oh gee, do you remember? And also asking them if they're older than a certain age, if they had the types of things that I just described to you in terms of how measles presents.
What do you say to people that are fearful of getting the vaccine? Is there any reason they should, is there anything you can say to them to maybe convince them to get the vaccine?
I've been trying for years, and it's a tough sell for some reason. But basically, probably with this vaccine, the first thing I would say is that the measles vaccine does not cause autism, which I think is the primary concern most people have. It's the reason most people, not only here in the States, but in Europe as well, have avoided having their children immunized. And that was based on information that turned out to be incorrect. A very small study in the UK that was published, if I remember correctly, in the late 80s. And it turned out the primary investigator on that study was in the hire of attorneys who were trying to bring a lawsuit against vaccine manufacturers that make measles, mumps, rubella vaccine. And for some reason, the public still seems to be fairly unaware of that. This guy does no longer have a license to practice in the UK because of all that. There have been large studies in the US, Scandinavia, a number of places that have looked at this issue, and there simply isn't association. So there's no association between measles vaccine and autism, nor any other serious side effect. It does cause fevers, and you can have things related to that are unpleasant, but they're not life-threatening. And even those are relatively rare. The vaccine, if you get 2 doses, is about 99.5% protective. It is one of the best vaccines that's out there. So those are the types of things that I say to people about getting the vaccine. It's really, really worth having. And the other thing is that measles kills children. In places where we've stopped immunizing, there have been noted deaths, particularly in the UK, where this has been a bigger, non-vaccination has been a bigger problem than it has been here.
What is the death rate on this, and is it only children that are usually at risk of death then?
No, adults can die as well, but I'm not sure I can give you a specific figure. I would have to go back into the older literature to look look that up in terms of what the death rate was in the bad old days before immunization. It's probably on the order of roughly 1 in 1,000 is the figure I remember off the top of my head. So most people get through measles. You're miserable, but you get through it. But there certainly are deaths. The incidence of encephalitis is probably somewhat related to the incidence of mortality. Encephalitis with measles is around 1 in 1,000, and I think the corresponding figure for fatalities is around 2 in 1,000 is what I remember. And that's based on the old days. We don't see that so much anymore, but you still have to worry about it when you have a case now. And I'm trying to remember, the outbreak in Dublin was, I believe, around 600 cases. And out of that, they had 6 fatalities. That was reported in Europe about maybe 20 years ago, something like that.
Have you talked about the treatment yet?
There isn't any, really, other than supportive treatment, which really means making sure that people are well hydrated, so IV or good oral fluids and so on. But there is no, unlike, say, influenza, where you can use something like Tamiflu, there's no antiviral that helps with measles that's been identified yet.
Let me ask one. Why do you think it's important for public health of El Paso County to get information out right now? I mean, if it's not a disease where fatalities I mean, if it's just 1 in 1,000, I know that's one person is terrible, but what is important for people to get?
Well, I think what's important to get relates to one of the other questions, which is what's the importance of immunization in the first place? And true now, that 1 or 2 in 1,000 is a pretty low risk when you have 1 case in the county in, roughly 20 years, or 2 cases in 20 years. So that's relatively low. However, the other side of that is we now have, from this Disneyland exposure so far, roughly 10 or 11 cases. Might get larger, and we've had outbreaks in the recent past in some communities in the Midwest that reached up to 100 or so. And then you're starting to incur some real risk, and you can't always control just who always gets exposed. We're lucky in this circumstance, again, because it happened in a hospital with fairly good controlled differentiated air distribution systems. The folks in Utah are dealing with a much tougher situation right now related to the same Disneyland exposure, in that they've got people that were wandering around in Macy's and a whole variety of very public places. So if these people were infectious at the time, they could, in theory, infect lots and lots and lots of folks. So you're really dependent on high levels of immunization to keep that from being a problem. So if you keep those immunization levels high, it's less of a problem. If they drop low enough, it can become a big problem. And that's what's happened in Europe, basically, in a number of European countries. The rates have dropped low enough. For example, I mentioned that outbreak in Dublin a number of years back. I think there were, what I remember, is about 600 cases, which is getting to be pretty substantial.
So in Europe, rather than being eradicated, it's being reintroduced to society.
Yeah, the Europeans, they've not eliminated it, interestingly enough. We have here, and not only us, but I mean the entire Western Hemisphere, right down to the tip of Argentina. All of North America, it is no longer considered endemic. So every time we or the Canadians or the Mexicans or somebody else have a case, it's almost certainly come from outside. And we try to keep it that way. That's part of the reason we're so on it when one of these cases happens. But the rest of the world is not in that circumstance, and it doesn't just have to do with developed or developing countries. The Europeans are having a real struggle with it.
One other question, the 200 or so patients, and do you have the names and the contact info for all those folks? Or are you asking for people as well to come forward? Because that may not be that may not be everyone who could have been exposed. Basically, do you have the names of all the people who could have been exposed and are tracking them, or are you asking them to come forward?
Everyone that, again, the beauty of this situation is the exposure mercifully was limited to in-hospital. So we have identification and hopefully soon all the contact information we will need in terms of telephone numbers and so on for patients in hospital. Of course, the hospital very easily knows all of their healthcare workers. But doing this is helpful in the sense that if, for example, there was somebody else in hospital that, say in the emergency department, accompanying someone that the hospital didn't have a record of or had come in as a visitor that the hospital didn't manage to capture, if they hear what you all report, then it's possible that they might say, ah, gosh, yeah, I was in that place at this time, on that floor, and nobody's notified me yet, so maybe I better call in. So yeah, there may be a few people that the hospital didn't know about. There may be.
So just to clarify, the patient was only contagious while they were at the hospital? Were they contagious at another point before they got?
They were contagious at another point before that, but it turns out that they were at home with their family and nowhere else.
That's fortunate.
Lucky us. That is really fortunate. I can't tell you how fortunate that was.
What the age of that woman?
Was it a woman? I didn't hear
We,
Adult woman.
yeah, I would say it was an adult. I would just say it's an adult, yeah.
that. Is it right now, you said what, the 23rd or 4th, if you don't see any more cases in El Paso County, we're probably in the clear?
Yeah. Yeah.
So is right now the most contagious where everybody should be paying attention, like today for the next week or so, if they come down with it? Like you said, it was what, the 3rd is when they're in
The
the hospital?
3rd, today is
When does
the
it, I guess,
8th.
kick in?
Yeah, no, it would actually probably start in another, the real uptick time would start in another few days. The incubation period kind of runs from 7, 8, 10 days out to 21. And so the exposure period was on the 3rd of January. So let's just take 7 or a week, 'cause that's a simple thing to deal with. Then you're kind of out to the 10th or 11th before we would expect to see any cases, and then track that all the way out to the 24th.
Anything we missed?
I don't think so. You guys asked a lot of good questions.
Can you say how often this happens here? How often?
This is you're talking about El Paso
Yeah.
County, not the U.S. in
Right,
general,
right, right.
or Colorado. This is only the first case of measles that we've seen in El Paso County since 1992, so not very often, which is a good thing, which again is testament to how well the vaccine is done in controlling this disease, but it, like I said, can be reintroduced into a community, and if people are unimmunized, those are the folks that get nailed. We're good?
We also want to mention the co-health for those folks that don't call.
Right.
I think at the very beginning.
There is, and you've got that number on the release, right?
Mhm.
Yeah, there, as in many cases with outbreaks of some sort like this, people will have all kinds of questions, and so there's a telephone line at the State Health Department that is reasonably user-friendly. It's an 800 number that's listed on that press release that people can call, and basically get information, and there's a very, very detailed set of questions and information that's even more detailed than what we just talked about, that people can listen to and go through and get information about measles, vaccines, all sorts of good things.